Blood vessels are carrying pressure right now. I'm not talking about emotional pressure. I'm actually talking about mechanical pressure. Every second, blood is gushing against the walls of your arteries, in your brain, your kidneys, your heart, your eyes, and every organ in your body. And the dangerous part of that all is that you usually do not feel it. High blood pressure is called the silent killer for a reason. It can quietly damage your arteries for years before the first major symptoms ever appear. It can quietly damage your arteries for years before the first major symptoms ever appear. And sometimes that first symptom is a stroke, a heart attack, kidney failure, or heart failure. I've seen it firsthand in the emergency room. I see patients coming in, 40-year-olds, they didn't know they had blood pressure issues, and now they're coming in with organ damage. So when we talk about blood pressure, we're not just talking about a number at the doctor's office. We're actually talking about a force that slowly changes the structure of our blood vessels, makes your heart work significantly harder. It damages your kidneys and overall increases the risk of a heart attack, stroke, diabetes over time. But here's where things get very interesting. For decades, most people were told one main thing only, to just eat less salt. And while that absolutely matters, especially for some people who are salt sensitive, lowering sodium can significantly reduce blood pressure. But the bigger mistake is thinking that blood pressure is only a salt problem, because many people who cut salt and still have blood pressure issues. So really, what's the issue there? Because the problem is that most modern hypertension often is not just a sodium problem, it is a metabolic health issue, it is an insulin resistance issue, it is a visceral fat problem, it is sleep, stress, and activity, and overall a consumption of ultra-processed food issue. Even if you only focus on salt, you're actually missing the bigger physiology driving the disease. So let's break this down in simple steps. Blood pressure is mainly controlled by three things. Number one is how much blood your heart pumps. Number two is how much fluid is circulating in your bloodstream. And number three is how tight or relaxed your blood vessels are. If your heart pumps harder, the blood pressure increases. If your body holds on to more fluid, your blood pressure increases. If your arteries become stiff or constricted, blood pressure increases. And in many people, all of those three are issues that are pushing your body in the wrong direction at the same time. Salt affects one major part of this system, the fluid volume. Sodium pulls water with it. So when you have an increased sodium consumption, the body may hold on to more water, increasing your blood volume and raising blood pressure inside the arteries. That's why reducing sodium can help many people. There is something called the DASH sodium trial, which showed that lowering sodium intake actually reduced systolic, the top number, blood pressure, and the DASH diet actually lowered blood pressure even more when combined with lower sodium. This is interesting because yes, sodium does matter, but sugar and refined carbohydrates affect blood pressure through a different mechanism. When you eat a lot of sugar or refined carbohydrates, glucose does increase. Your pancreas releases insulin, and most people think insulin only controls blood sugar, but in reality, blood insulin also affects the kidneys. Higher insulin levels can signal the kidneys to retain sodium. So that means that even if you're not eating a ton of salt, chronically elevated levels of insulin can push your body in the wrong direction, upwards, basically holding on to more sodium and water. That becomes especially important, especially for those who have insulin resistance. In insulin resistance, the body has to produce more insulin to get the same glucose lowering effect. So insulin stays elevated a lot longer. And when insulin stays elevated, the kidneys may keep getting the same message over and over again: retain sodium, hold on to sodium. And because they're holding on to sodium, they're also holding on to volume. And because they're holding on to volume, the blood pressure is. And this is one main reason why people with abdominal obesity, prediabetes, fatty liver disease, metabolic syndrome can also develop high blood pressure. It's not random. It makes sense. They're all connected. So now let's talk about fructose. Fructose is found in table sugar and high fructose corn syrup, especially in sugary drinks and ultra-processed foods. And fructose is processed largely in the liver. So when you consume a lot of fructose in the form of high fructose corn syrup, like in sugary drinks or high processed foods, it can contribute to fatty liver disease. insulin resistance, elevated triglyceride levels, and increased uric acid. And uric acid is interesting because uric acid is important because higher levels may actually impair nitric oxide availability. And nitric oxide is one of the molecules that your blood vessels uses to relax. Less nitric oxide means stiffer blood vessels. So the blood vessels are not able to relax when there's less nitric oxide. Stiffer blood vessels means higher blood pressure. So this is a term called higher vascular resistance. That basically means higher resistance in the vessels, which equals higher blood pressure. So when you consume a lot of sugar, that's going to contribute to high blood pressure and through multiple different pathways. More insulin, more sodium retention, more sympathetic nervous system activation, more vascular stiffness. The blood vessel is stiff, like I mentioned, more visceral fat, and worse endothelial function or function of the artery itself to do its job. This does not mean that salt isn't contributing at all. It just means that the real villain for many people is not the salt shaker. It is truly the ultra-processed diet, because ultra-processed foods often combine high sodium, refined carbohydrates, added sugar, low fiber, low potassium, as well as low protein. And that combination is truly what's driving blood pressure. It's not just a salt issue. Yes, sodium increases fluid volume, but refined carbs increase insulin, and low potassium reduces one of the body's natural counterbalances of sodium. So when you have a combination of all those things with low fiber that's worsening glucose control and satiety, you're going to have an increased pattern of high blood pressure, eventually leading to promoting weight gain, visceral fat, insulin resistance, and chronic inflammation. This is why telling people to only cut salt is incomplete. So it's not just a salt issue, because a person can eat a low sodium processed diet and still be metabolically healthy, and a person can season whole foods while eating high fiber, high potassium, minimally processed diet, and have a much better cardiovascular physiology, better health metrics. What actually lowers blood pressure long term? Based on data, we know that the first thing we have to do is reduce ultra processed foods. That is probably one of the most important steps. Not because every processed food is poison, but because ultra-processed foods tend to deliver the exact combination that I'm talking about. It's worsening glucose regulation because of refined carbs, high sodium, low fiber, low potassium, and excess calories. So by replacing packaged snacks, fast foods, sugary drinks, and refined carbs with whole foods, we are able to have a better control of blood pressure. Second is increasing potassium-rich foods. Again, potassium helps the kidneys excrete sodium and supports a healthy blood vessel by helping them relax. Good sources of that include potatoes, beans, lentils, bananas, spinach, avocados, and other fruits and vegetables. This is one main reason why the DASH diet works so well. It's not just focusing on low salt, it's focusing on high fruits, high vegetables, low fat, dairy, legumes, nuts, whole grains, and potassium-rich foods. Third is increasing fiber. The diet above will help you increase fiber. The reason why that's important is because fiber slows glucose absorption, improves insulin sensitivity, improves satiety signaling, helps with weight management, and supports overall gut health. Most adults are dramatically under consuming fiber. Target to follow is roughly around 30 to 38 grams of dietary fiber per day. Some great sources include beans, lentils, oats, berries, chia seeds, fruits and vegetables, and it's important to be consistent with this because that's what's really going to drive the needle forward. Fourth is losing visceral fat. This is very critical. Visceral fat is the fat stored around internal organs, and it is strongly associated with insulin resistance, inflammation, fatty liver disease, elevated triglycerides, and high blood pressure. So even modest weight loss can significantly reduce blood pressure in many people. Not because weight is everything, but in reality because reducing visceral fat improves metabolic signaling that drives high blood pressure. Fifth is move daily. It's important to exercise to lower blood pressure through several mechanisms. This is how it works. It improves insulin sensitivity. It improves endothelial function, basically the function of the arteries. It is going to increase nitric oxide. So the production of nitric oxide is actually going to make your vessels relax, decreasing your blood pressure, and it's going to reduce sympathetic nervous system throughout the day, and it's going to support weight loss as well as visceral fat reduction. That's if you're at a calorie deficit, and overall it's going to strengthen your heart and blood vessels. The goal is not to do everything at once. The goal is to start slow, not to be perfect. Start with walking, because even walking after meals can help dramatically reduce glucose spikes and improve overall insulin sensitivity. Then you could add resistance training 2 to 3 times per week for up to 30 minutes per session, because muscle is one of the biggest glucose disposal organs in the body. More healthy muscles generally means better metabolic control. And last but not least is sleep. Poor sleep is one of the most underrated drivers of high blood pressure that we know of today, and it's something that a lot of people are not doing enough. Sleep often is short, fragmented for most people, and that's going to cause sympathetic nervous system activity to rise, increasing cortisol levels, and that is going to drive insulin sensitivity, insulin resistance, and increase hunger, and overall it's going to increase blood pressure as well as worsen obesity. That's what we know, that a lot of times someone could easily change their sleep and change their diet and see dramatic results. Not necessarily, they don't even have to work out. So if someone snores loudly, wakes up gasping for air, has morning headaches, or feels exhausted despite sleeping, something to consider is also getting a sleep study to see if you have sleep apnea, because sleep apnea is one of the major causes of resistant hypertension. So even if you're doing all the above, you have sleep apnea, that might be the reason why your blood pressure is not improving. This is number 7. 7th is limit alcohol and stop smoking. We know that alcohol and smoking are drivers of poor metabolic health. It's going to increase your blood pressure, it's going to worsen your sleep, and overall it's going to increase your risk of a heart attack or stroke. So if your goal is preventing heart disease and stroke, this absolutely matters. Now here's the key. Medications are not bad. I prescribe them all the time. They reduce stroke risk, they help with heart attack risk, they help with kidney disease progression, and overall heart failure risk. But the important thing is that you have to do everything within your power to improve your lifestyle first, because medications work best when the underlying physiology is also improving. So even if you're on medications, you're doing everything bad of the above, you're not following any of the advice I'm giving you, the medications are not going to work. You're going to have to increase your dose to fight against this metabolic issue. An ACE inhibitor can only do so much. A diuretic can only do so much. A calcium channel blocker can only do so much. But if the person is still insulin resistant, sleep deprived, sedentary, eating ultra processed foods, gaining visceral fat, drinking nightly, the system is still being pushed toward high blood pressure. That's why lifestyle is not just a prescription, it's a life force. You need to start doing it right away, because food really changes your physiology. Exercises will improve nitric oxide, sleep will change your sympathetic tone, and weight loss will decrease vascular resistance, obesity, and fiber will help you control glucose a lot better, and potassium changes sodium balance. These are all metabolic drivers, and this is something that I highly encourage you to start looking into. So the question really the question is not really salt versus sugar. The better question is, what is driving your blood pressure? Look at your life today and ask yourself, what is truly driving your blood pressure? What lifestyle modifications you have to do to help improve your blood pressure as well as decrease your risk of a heart attack or stroke? For some people, sodium is a major driver. For others, the bigger issue is insulin resistance, visceral fat, sleep apnea, alcohol, stress, or inactivity. And for many others, it is all the above. That's why the most effective approach is not obsessing over one ingredient, rebuilding the metabolic environment that allows your blood pressure system to regulate normally again. So the practical lesson moving forward is reducing ultra-processed foods, limit sugary drinks and refined carbohydrates, making sure you're exercising 3 times a week for up to 30 minutes a session, and keeping sodium reasonable, especially if you're salt sensitive or you're already suffering from heart failure or high blood pressure. Increasing potassium-rich whole foods, eating more fiber, walking daily, at least 10,000 steps a day, making sure you get adequate amount of sleep, at least 7 to 8 hours of sleep, and obviously reduce stress. Even though it's going to be hard, reduce as much stress as possible. And overall, all those steps will help you lose visceral fat, basically allowing you to have better health markers and also improving your blood pressure in the long run. And of course, limit your alcohol consumption and smoking. You got to quit that. And My advice is to make sure you get a blood pressure cuff and monitor your blood pressure at least weekly. And if you have blood pressure issues, daily is also recommended, because at the end of the day, high blood pressure is not just a number. It's a signal that your cardiovascular system is under way more force than it should be, and it's a signal that you cannot ignore. And the earlier you listen to it, the better you will be.